Should older siblings attend the birth of their baby? I'll tell you everything you need to know. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fizet. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Hi, I'm Dr. Natalie Fizet. We're going to talk today if older siblings should attend the birth of a baby. Well, first things first, is it possible? If you're giving birth in a hospital, inquire if it's possible. If you're giving birth at home, of course it's possible. You're the boss. If it's a birthing center, it's halfway. Again, they have rules or protocols, so ask them if it's a possibility. Second things is they usually say any child under 3 years of age it's not recommended because they don't understand what's happening and they might get even traumatized at one point of the birth because they don't know what's happening. Third thing is you have to know your child. If your child is like high maintenance, always asking for you if you're in the room, you're going to be in labor. You're going to be busy giving birth, so you cannot attend your child. So it might not be a good experience for him or her. And your child might feel like once the baby comes, it takes all your attention. So there might be jealousy building up, so it's not the best. It won't be the best experience, and for that you might not be able to give your attention to your child because you have to focus on what's happening in your body. So it's asking for a lot if you have a child that's really close to you and, should I say, demanding. For instance, I had a patient that right after giving birth, her youngest, which was 5 years old, well, or oldest now, which was 5 years old, came in the room and he started playing with the bed, like pushing the buttons, and she was being squished like a sandwich. And she was like, "No, stop!" And he was playing with the bed and, fussing around and everything. And she just gave birth and she was exhausted. So poor mommy. So you have to know how your child is. If you have a child like this, it might be best to. Some people bring the child to bring mommy to the hospital, and then they say, "Okay, let's leave. Mommy's gonna have the baby," and then the child feels like, "Okay, mommy's in a hospital bed." And they don't understand that she's gonna come back in 2 days with a brand new baby. So it's sometimes I've seen little children cry, like clinging on to their mummy and say, "No, I don't want to leave," and everything. So the best, if you have a child that's really, again, very close to you, is that they come and get you from the hospital when you go back home, so that way they're feeling like, "Okay, I'm the one who got mommy back home." If just saying, "Okay, say goodbye to mommy, we're gonna see her in 2 days," 2 days doesn't exist for a young child. So again, you have to know your child, and because separation can be a lot, and if it's a hospital, it can be impressive for a young child. The second factor is you have to know yourself. You gave birth already because it's your second child. This is the whole topic of this video. If try to remember how you were in labor. If you were composed and like in your bubble, and if you, especially if you took the Hypno-Baby course, you were doing great. But if you did not take the Hypno-Baby course and you were screaming and you were huffing and puffing, your child might not understand. And if you were screaming, your child might feel like you're in pain, and it might be terrifying for your child. I've had a patient that had her two daughters that were, I think, 6 and 7 years old, and they were at the end of the bed, and they were, "Oh, baby's coming." They were all happy. And my patient giving birth, and there was a lot of people in the room too, and my patient giving birth let out right before the baby came out. She said, "I'm gonna die." And the two little girls started like screaming and crying and shaking, like, you hear your mother saying, "I'm gonna die." They did not understand, and then everybody had to comfort them and saying, "No, no, she didn't mean it," and everything. But they might have a trauma right there, and they might reconsider having like any children of their own. So you have to know yourself if you're a scream. And then my patient told me, well, I said that at their birth too. So I'm like, yeah, that's a good reason not to bring your kids. If you're gonna scream, I'm gonna die, they don't know that it's just an expression. For them, it's real, and then it's like they could have PTSD from the birth. Always make sure you plan that there's going to be a person taking care of your children, allowing them, if they want to get out of the room, that they can. Okay, because sometimes they, if you moan, or if you do noise, or if you say you're in pain, they might not like it. I've had again a patient that had her two older children. They were all dressed up in doctors, really cute, but at one point she was like, she did not take the Hypno-Baby course, and she was like complaining with the contractions because she was in pain, and they started crying like crazy. And then you need like another person that can get them out and play with them, or get their, just go to the vending machines or whatever kids can do. And it should not be your birthing partner, because you don't want your birthing partner to miss the birth because your older child wants to get out at the second the baby comes out. So that's really essential. Plan a third person, and don't rely on the staff. The nurses are already like barely doing all their job. They have so much to do, so they don't have time to babysit, that's for sure. So it has to be a person that they know, an auntie or a grandma, that will not, if she misses the birth, she's okay with that, that they know when they like, and that they can get out if they want to. You also have to take into account that during the birth, there's blood and there's all kinds of fluid coming out, so it's impressive. And sometimes there's tearing and all kinds of stuff happening. So I've had a patient that asked me if I had a video of a birth, so I lended one video random that I had in my office, and she was planning on bringing her 7-year-old daughter to the birth of the baby that was coming. So she showed the video to the daughter, and the daughter went, "Ah, that is so gross," and she just left the room. And the mom said, well, I have my answer, so she's not interested in coming. The a child can also be jealous, because once your baby's going to be born, it's going to be on you, and you're going to be, oh my god, oh my god, and it might not be a good transition. So you have to select this. A good trick, if you don't have the child, or even if you have the child attend the birth, or if you go home and the child did not attend the birth, is to give a gift of something that they really like, and say it's from the baby and us. So that way they're like, oh, that baby's cool, gave me a gift and right on my what I like. If you get to the conclusion that your child is, it's not, it won't be the best experience to see the birth per se, like the baby coming out, or if you feel you don't want to show your private parts to your child for any kind of reason, you can always decide that your older child will come in right after the baby's born. So that way, they have a really fresh baby, so the bond starts right away. And children who attend in a positive way the birth of their siblings really have a special bond with them, because it's right from the birth, and they're amazed by it. So that could be another option, is to have someone take care of your child. But sometimes labor can take as it can take like 10 hours, even if it's your second baby. So having someone take care of your child, and then they can come in right after the birth, and then you can bond with the fresh baby, and so forth. And then you're really like bonding your family. So these are all the factors to take into consideration. The first one is ask if it's possible, because you might plan something, and like I said, if you have a home birth, that's easy, because that's it's your house, it's your rule. Put in the comments below if you had an older child attend the birth. Was it a good experience? Was there something you would do different? Is there advice you would give to other mummies that are considering having the older children to attend the birth of the baby? See you in the next video. Bye bye.